Physician burnout has gotten to be a really important topic, especially in the last couple of years. And I think what drove that a lot was a study from Mayo Clinic that came out at the end of 2015, which did a survey actually of Mayo Clinic doctors and found that more than half exhibited signs of burnout, which is pretty serious business. And I'll go over in a few minutes why that's so important. So just in the last couple of years, there's been a lot of talks at both, general medical meetings and also in subspecialty meetings, even radiology, which is probably about the last to hear about this kind of stuff. And you'll see why it's important even in radiology. So basically what I want to do is to introduce you to the concept of burnout, talk a little bit about what causes it, and also what you can do to try to prevent it. And if it happens to you, which it probably will sometime during your career, what to do about it. Thank you. Okay, financial disclosure. I formed a company about a year ago called Healthcare Coaching Associates, specifically to deal with issues, both individual issues and also organizational issues related to change, which is happening rapidly, stress, which we're all under, and burnout, which is one of the consequences of stress. Right now, I'm primarily focusing on physicians. I have a nurse and a social worker that are working with me, and we hope to do more organizational stuff as time goes on. But this is kind of a new company, it's a new venture for me. Because until about 3 years ago, I was a practicing radiologist. I practiced for about 30 years. And about 4 years ago, things started to happen in our practice. We were a group of about 16 diagnostic radiologists. We had 5 offices all over Orange County, and we were financially successful. We weren't going belly up. But what happened was we decided, our equipment was getting old, our MR scanner needed to be replaced, and we went to try to borrow money, and we couldn't borrow money because banks weren't lending money to doctors. The doctors are now fairly poor credit risk. So we ended up actually selling our entire group of practices to a national corporation. And that started a whole chain of events, which we'd not experienced, but was doctors in a lot of other fields have already experienced. For example, cardiologists, internists, the vast majority of them now are employed. They're not in charge of their own practice. And as a radiologist, chances are you're going to be employed either by a group or by a multi-specialty group. And things changed. What changed, first of all, is that we lost control of our own practice, our own practice environment. We had a lot of the same employees, but the employees didn't work for us anymore. And that caused a whole series of conflicts. In addition, the workload increased, and in my opinion, the quality decreased. And the quality decreased simply because we were doing much too much work in the same amount of time. So that was change, and it was stress. And at the same time, it was kind of a perfect storm. My marriage was falling apart, and my kids had moved out of the house, and it just all came together into kind of a perfect storm, and I went into a cycle of burnout. And over the period of 1 year, I lost my marriage, my house, my retirement savings, my job, and I almost lost my life. And, it taught me a bunch of lessons, which I'm going to share with you. So hopefully you won't have to go through the same thing. So what is burnout? Burnout is something that was described by Christina Maslach, who's a psychologist at Berkeley. And it's a phenomenon that occurs most commonly among people that are doing people work, so doctors, counselors, social workers, even peace officers. And it's characterized by a triad of 3 things. Emotional exhaustion, which is, I'm sure you can understand what that means. Depersonalization, which means essentially objectifying people, no longer being able to empathize with people. And a decreased self-accomplishment. You don't feel like you're doing a good job. There's a decreased sense of self-efficacy. And that triad is what constitutes burnout. Now, there's a lot of overlap with symptoms of anxiety and depression is often a feature of burnout, but it's not the same as burnout. So what causes burnout? Well, burnout is caused by stress, and the whole concept of stress, as we use it today, psychological stress, was developed by this researcher, Hans Selye, way back in the 1930s, who basically just described stress as a response of the organism to any demand for change. And he went on to show, you can sort of see in the slide here, that persistent stress can cause development of various disease states in animals and in people by chronic activation of the hypothalamic adrenal axis, which also affects, as you can see, the thymus. It has to do with the immune system. So it's a whole constellation of diseases that are related to chronic stress. Now, all stress isn't bad. There is good stress, or what he called eustress. For example, you get a new job, you pass an exam, and it's stressful getting a new job, but it's a good stress. You have a new job, you have new opportunities, and so stress in the right amounts and of the right type actually causes an increase in performance on the human performance curve. And that's what this is shown here, the human performance curve. But you reach a point which is aptly named the hump. And when you go over the hump, basically what happens is your ability to adapt doesn't keep up with the demand for change. And then what happens is you start, at first slowly and then more rapidly, losing the ability to adapt to stress, and you start getting these maladaptive responses. So stress basically is caused by conflict. It may be an interpersonal conflict, or more commonly, it's a conflict of time demands, energy demands, or even a conflict between your own belief system and what you're doing. So any kind of internal conflict causes internal anxiety and leads to stress, because the body wants to resolve conflicts, the mind wants to resolve conflicts. And if there's an adaptive response, then the conflict gets resolved. And this is the stress cycle when it works properly. Now, as you know, there's a lot of common conflicts in healthcare, and I've just listed a bunch of them. And some of these affect primary care doctors more, and some affect radiologists. For example, life and death decisions. You're looking at a CAT scan in the middle of the night, and you decide whether the patient goes to neurosurgery or not. And you may be looking at a bunch of them all at the same time. This is really stressful. We have high volumes in every specialty now. A lot of productivity demands, particularly in radiology. Our group, I know, measured RVUs. We didn't compensate for it, at least at the time, but we measured it and it was reported, and that was pretty stressful. And there are interpersonal issues, of course, at work. And difficult patients and their families, not so much for radiologists, but particularly for primary care doctors, that becomes a real issue. And interestingly, leadership qualities are very important. There was a study that came out maybe 6 months ago that showed that the incidence of burnout in medical groups was closely related to the quality of physician leadership in the group. And so there's been a lot more emphasis recently on what kind of physician leaders and what kind of administrative leaders can help reduce the incidence of burnout. And of course, we all have personal conflicts. I don't know how many of you have families, but if you have a family or if you have a relationship of some kind, there's going to be demands on your time. And sometimes it's hard to resolve those demands. It's hard to make your family understand, that you have to work 12 hours today, or you're going to be gone till midnight. Finances is something that really has become much more of an issue, especially for you guys. I'm embarrassed to admit I graduated from medical school with $30,000 in loans. But then at that time, UC had a tuition of, I think I paid $1,600 a year. Things have changed, right? So it's not uncommon for young doctors to come out of training with $250,000 or more in debt. And that's a big stress because, you start off working and a lot of that money has to go to paying off debt for the first 10 years. Vacation, time off is sometimes a problem, not so much in radiology. Sleep deprivation definitely is a problem, particularly in, if you're working in a trauma center or if you're a primary care doc. Lack of work-life boundaries. This is something that's really been much more of a problem in the primary care sector, because what's happened is, in radiology we had, I guess I would call it the advantage of going electronic really early. So we're used to electronic medical records. Everything we do is electronic. It's not stressful for us. In fact, for most of us, we found a way to make it work so that we're more efficient. But the poor primary care doctors are now going through what we went through, the very first iteration of F.A.C.R and RIS, which was like, nothing works. I don't know if you remember this. I'd call up my IT guy and go, he goes, just relax. Just uncheck the box that says nothing works. It's not that simple with the, with electronic health records. And what happens, I think, is that a lot of the primary care doctors now spend a lot of their time actually in the room with the patient on the computer. And they don't have time to review that. They got to go on to the next patient. So they finally get home at 6 o'clock at night, grab a bite to eat, and then they spend 2 hours going through their medical records, correcting them, and doing all those things. So your work is kind of like bled over into their personal lives, and that's caused a lot of stress. Business management is really kind of less of an issue for most doctors, but as a radiologist, I was a managing partner in a group. We spent a lot of time dealing with business and the economic stresses of having to keep the business running, and then litigation can happen to anybody, and that can be very stressful. Now, what happens when the body and the mind don't adapt to stress in a constructive manner? You get this chronic stress response, which essentially is a chronic arousal of the fight or flight system. It's a system that was developed, several 100,000 years ago in Africa to get us away from lions and other beasts. However, most of the beasts we deal with today are at work or at home or even in our heads, and we can't get away from them. And so we develop this chronic stress response, which can result, as I said, in chronic activation of the hypothalamic adrenal system, high blood pressure, and all the other physiologic responses, but also, psychological responses, and anxiety and depression are two of those responses. Sometimes the response is just, we go into a funk and don't do well. Other times we see, and I've seen this a lot, see actually disruptive behavior among physicians, nurses, and other healthcare personnel. And when I was working at a hospital, I was a hospital-based physician for about 25 years. In the last 4 years, I was chairman of the Physician Well-Being Committee, which actually had nothing to do with well-being. It was actually a way for the administration to sort of say, we got this guy that's, either acting out on the wards, nurses are complaining about him, he threw an instrument in the OR, and we don't know what to do with him, so we're going to send him to you. You need to talk to him. And the physician well-being committees were originally designed to deal with physicians with substance abuse problems, alcohol and drugs. But by the time I had come along as the chairman of the Physician Well-Being Committee, that was really a minority. I think I had one or two doctors I was following who had, DUIs or, maybe an anesthesiologist with a drug problem. Most of what I dealt with was disruptive behavior. And at the time, I really didn't understand burnout. This was maybe 8 years ago or so when I was doing that. And I looked at these guys, and I said, they have a lot of symptoms of depression. So maybe what this is untreated depression. And, I didn't really have the authority to specifically require them to get help. But I would sit down with everybody and have a heart-to-heart and say, listen, I'm here to protect you from yourself. You're getting yourself into trouble. I know there's something going on. I'm not going to delve into it, but here are some suggestions. And just to try to get them over the hump and to get them into more constructive behavior patterns before they ended up essentially going to the medical board. So that we still see that quite a bit. And in radiologists, that's not uncommon also. And finally, you can enter this downward spiral and end up burned out. And This is what I call the burnout spiral, which is basically you have the unresolved conflict, the chronic stress. You get emotionally exhausted from not only dealing with your own internal stress, but dealing with the increasingly difficult and fraught relationships at work and at home. Yeah, you end up essentially getting a lot of symptoms of depression, and finally you go into burnout. And with burnout, basically, you just become not completely non-functional, but you function at a much lower level. Or in my case, I became basically non-functional. I ended up in the hospital. But oftentimes it doesn't go that. We find that doctors go through cycles where they get, burned out, and they're just not doing very well. They recover, they get burned out again. And if you talk to any doctor that's been in practice probably for more than 20 years, you say to them, tell me about your burnout. And they'll say, well, which one? Because this stuff comes and goes, depending upon the level of stress, the changes you're going through, a lot of other internal and external factors. So some warning signs of burnout: increased irritability, outbursts of anger, use of alcohol or other drugs, even having affairs, the result of burnout. Sometimes it's working out at the gym till you hurt yourself. Sometimes it's being a workaholic, spending too much time at work. But these are all basically just signs of poor response to stress. And there's some things you need to be aware of. If you see them in yourself or in a colleague, you might encourage them to get some help. One of the problems with burnout is that, oftentimes you don't see it as soon as people around you see it. Other people are much more aware of the fact that you're acting funky than you are. You just think, well, I'm a little tired today, I'm a little stressed, I don't feel so good. But other people say, no, he's just not himself. She's just not herself. This is not the way she usually is. So you may see it in a colleague before they see it in themselves. And so one of the best preventive measures for burnout is peer support. Saying, I notice you're having problems. Do you want to talk about it? Much easier for a woman than a man, obviously. But it's worth. I know in my group, I had one person approach me and say, what's going on? Out of 16 people, one person, a woman, say, what's going on? There's something going on here. And I, like many other males, I didn't want to talk about it. It's like, oh, everything's fine. Meanwhile, my life is going to hell. And burnout has consequences. Professional consequences of burnout are changes in the physician-patient relationship, but also changes in the quality of patient care. Burnout, and this is the number of studies done, published in the surgical journals, showing that there's a direct correlation between burnout and medical errors and surgical errors. And it results in more malpractice suits. Overall, you become less able to relate to patients and patients to you, so the overall level of professionalism decreases. Patients see there's something wrong, and they start to lose trust and confidence in their physicians. And that results in a combination of things: dissatisfaction with their care, and also decreased compliance with their medical care. Personal consequences of burnout: depression and anxiety, we talked about. Broken relationships, divorce. This is one study that was, I think, about 4 or 5 years ago, actually in Canadian physicians, and Canadians are pretty happy-go-lucky people. But 55% of them, at least my experience, reported that their family life has suffered as a result of their professional life. And alcohol and substance abuse are not uncommon ways of sort of self-medicating the depression or the anxiety. And suicide, this is the most serious. And 300 to 400 doctors a year in this country commit suicide. I should say they die by suicide. I don't like the word commit because it makes it sound like doing a crime. But they die by suicide, usually as a result of untreated or inadequately treated depression. And that's 2 times the national average for men and 4 times the national average for women. It's huge. It's the equivalent, essentially, of 2 to 3 graduating medical school classes a year. And that is such a waste. And oftentimes, it is physicians in training. medical students and residents, because a lot of them haven't yet developed the ability to deal with chronic stress, and so they're particularly affected. And that's one of the reasons why, it's sort of one of my personal goals is to work with medical students. And I am working with first and second year medical students already at UCI, and I'm starting to work with the different residency programs. But it's interesting, even a place like UCI or UCSD, where I went to medical school, they've got very well developed physician wellness programs, and yet they don't really have the resources. I mean, if you're like super depressed and you need to go see a psychiatrist, you can do that through student health. But as you'll see coming up, it's really not necessarily the best way to deal with burnout, because it's not really a psychiatric disease. It's actually becoming a new norm. And one of the risk factors for burnout is, I say burnout starts in medical school, and that's why I'm putting a lot of emphasis on that. And I do all that work for free, basically. Burnout actually doesn't begin in medical school. It probably begins in kindergarten with certain personality characteristics. But since we can't tell in kindergarten who's going to end up being a doctor, I say burnout begins in medical school, because at least we know the people that are in medical school are probably going to go on to become doctors. And one of the things that puts us as a group at risk, whether we're men or women, is these, what I call the prime directives of medicine, these sort of things that we learn that get hammered into us, that we carry with us, that are kind of like, they're like internal restrictions on our behavior and our thought processes that don't allow us to think outside the box and really adapt properly to stress. And these are the ones, never show weakness, the Superman complex. Even the women in medicine, they're trained, to act like the guys. It's not as bad now as it used to be, because now about 50% of medical students are women. When I went to school, it was like 1 out of 6 was female, and a lot less than that were radiology residents. And so they really got sort of doubly pushed because they had to prove themselves more. I think they got more harassment and abuse oftentimes than the men. But you were never supposed to show weakness. You have to be Superman or Wonder Gal or whatever. And the other thing we were taught is that you can do anything by yourself. You shouldn't ask for help. You should learn how to do it yourself. You've got to be self-sufficient. And the final one is the patient always comes first. And it's true the patient's important, but if you don't take care of yourself, who's going to take care of your patient? Who's going to take care of me when I get old? You guys need to stay healthy. So those are some of the things that we learn in medical school that kind of stand in our way. They're like internal obstructions to dealing properly with stress. And for residents and practicing physicians are more similar in terms of their stressors, because by that time you've kind of overcome a lot of the stresses in medical school. And these are some of the risk factors. We talk about lack of control, poor physician leadership, sleep deprivation. For the family practice guys, the problem with electronic health records are still working out. Problematic relationships both at work and at home, and if you have any kind of concomitant illness, or if you get old like me and you just can't remember stuff, that's a risk factor for burnout. And here's some awful statistics if you want to see them. Between 2011 and 2014, the incidence of burnout in practicing physicians increased by 20%. It's unbelievable. And I think a lot of that has to do with corporate practice in medicine, employed physicians, and electronic health records. I would point to those two as the two primary factors that are causing stress among doctors. It's the lack of control and being asked to do clerical work and take care of patients at the same time. Interestingly, there was a study done on medical students that at one point during their medical school, 75% of residents had at one point or another been on antidepressants. Not residents, medical students. That's huge. And those are people that actually sought help, which means probably during medical school, 100% of medical students at one time or another were depressed. So that's really important. We talked about suicide. And basically, your chance of developing burnout over the lifetime of your career is 100%. It will happen to you. And the more you know how to prevent it and take care of it, the quicker you'll rebound and the less harm will be done to your career, your family, and your patients. And these are some recent statistics. In case you thought radiologists were completely immune from this, they're not real high on the list. The highest ones obviously are the general medicine groups, ER. Don't ask me why dermatologists are stressed out. Go figure. But radiology is in there, and look at the change. You know, less than 50% to over 60% of practicing radiologists have symptoms of burnout. This is not good. Now, one of the things I like to do, and that's the second form, I'd like you, if you wouldn't mind going through this while we're talking and filling these out. You don't need to put your email address or any identifying factors on there, but I'm going to use these two things. Number one, I want you to do the inventory just for yourself. And number two, I'm actually collecting statistics. They're anonymous statistics. And so if you could just put down, you know, kind of what year you are, if you're a medical student, you know, M2, M3, if you're a resident, PG, Y1, 2, 3, 4, et cetera. It would be helpful to me because a lot of work has not been done on the efficacy of coaching, and I'm hoping to change that by collecting some data. So please fill these out at your leisure. One of the things that we look for in coaching are actually two things, specifically pains and wants. We want to know what is it that causes you pain, both at work and at home. And I just put some examples up here, and there's some more examples on your papers there. And feel free to write in anything else that I've forgotten. I just kind of used my own experience. So what are the things that cause you pain at work, or things that cause you pain at home or in your personal life? And then number two, what do you want? What are the things you want most? What are the things you want most at work? And what are the things you want most in your personal life, whether it's your home relationships, whether it's your personal goals, or even your spiritual goals, your spiritual life. So if you would make a list of that, that would be really helpful to me. Because what I do is actually I will be addressing these in my blog. And hopefully, and by all means, please take a card. There are lots of cards here. You can pass this around one more time. And on my website, there are several places you can sign up to sort of subscribe to the blogs. I've been sending them out an average of like every other week, so it's not even going to get overwhelmed with email. But if you want to get the blogs, or if you want any information, all my contact information is on my website. So what do we do about physician burnout other than prevention? Well, there's several things, and coaching is something that a lot of people aren't aware of, what coaching is, and that it can be useful for burnout. Coaching is not just mentoring. It's not just, you know, somebody who, you know, has been there giving you a talk. Coaching is actually a very specific process that we go through, and I'll be talking about that process in detail in a few moments. But there was this nice article that came out a couple years ago in the Journal of General Internal Medicine talking about the benefits of coaching in dealing with burnout. Now, interestingly, even though there's been an incredible amount of research on burnout and the risk factors and the causes of burnout, there hasn't really been a lot of research about what to do about it. I think that's kind of interesting. It's something that I hope to change a little bit as time goes on. So what is coaching? Coaching is, first of all, let me say coaching is not psychotherapy. And I'll point out some of the differences. Psychotherapy is performed by a licensed mental health professional, which means either a psychologist, a psychiatrist, or somebody with a master's in social work or psychotherapy. That's like a legal necessity. Psychotherapy is based on DSM-5 diagnosis. You need to have a diagnosis in order to be referred for psychotherapy. It may be covered by insurance, and there are very specific confidentiality requirements in psychotherapy. There are HIPAA requirements, but there are also specific reporting requirements. And this is one of the reasons why I think a lot of people don't go to see a psychologist or psychiatrist, or in my case, for example, I went and paid cash, so that nobody knew. Because if the psychiatrist or psychologist feels like you are impacted enough by your DSM-5 disease or process that it may interfere with your professional duties or endanger patients, they are required by law to report that to the medical board. And it can actually result in limitation or loss of license. And so a lot of people either avoid seeking help for their depression, or if they do seek help, they do it anonymously, they pay cash, they do anything they can to avoid anybody else finding out about it. Coaching is different. Coaching currently has no specific licensure requirements. Most reputable coaches, myself included, take a course of at least a year in specific coaching techniques that includes supervised coaching. So you work with fellow students, usually in a webinar format, with an experienced coach. And the two coaches I work with in my program were both PhD psychologists, but they had years and years of coaching experience. And so you have supervised practice as you learn the techniques. Coaching does not require any kind of diagnosis. There's no pathology necessary. All you need is the desire to either get away from something that's bothering you or to get something that you want. It's not covered by insurance, which can be problematic for some people. Now, what I've done, I've got I would consider a fairly modest rate that I charge for, full-fledged professionals. I give a markedly reduced rate for residents and medical students, about 50% off, basically. But one of the things I'm planning on doing very shortly is to start doing a group coaching format using webinar software, which will be more interactive and hopefully bring the price way down so that we can make it accessible to everybody, basically. The confidentiality requirements aren't there, but basically I use the same confidentiality requirement I would for a patient. I use essentially HIPAA-compliant communications and recording. There are no reporting requirements. If I feel like somebody is depressed or even suicidal, I will strongly recommend that they seek professional help from a mental health professional. I may give them a referral, but I can't make them do it. I have no obligation to report to anybody what their issues are. With psychotherapy, it's more based on kind of understanding the internal dynamics based on your past history and all that stuff. In coaching, it's really more on, what can we do moving forward to get you through this and to get where you want to get to go. And psychotherapy is almost always done in person. Coaching is usually done either by phone or Skype or one of the other internet-based communication tools. So what is the coaching? Coaching is a process, which is a collaborative process between the coach and the client. And the first part of coaching is really a lot of questioning to find out what it is, what the client's pains and wants are, what it is that's bothering you, either at work or at home, and what it is you want, short-term and long-term. And then we do a phase of evaluating what your strengths and resources are. Everybody's got different strengths and weaknesses, personality strengths, experience strengths, resources, whether they're internal resources or external resources like family, church, whatever, to get a good idea of what do they have to work with. And then there's a phase of sort of looking at what your beliefs are. What are the things that are holding you back? I mean, are you not seeing a solution to a problem because you have this fixed belief? The Superman complex is one. And to basically see that belief from the outside so it no longer has that control over you. So you can say, okay, I can think outside of this now and see a solution. And then we actually develop specific goals, whether they're personal goals or professional goals. And we use this acronym SMART um, to describe the goals. They're specific, they're measurable, they're attainable, which means it's within reason, relevant, both in terms of meeting your own professional and personal needs, but also what I would say ecological. Goals that actually match your own internal beliefs and your own internal structures, whether it's religious beliefs or personal beliefs, and time bound. What that means is we sort of have a time frame for achieving these goals. And what that allows us to do is develop an action plan. And action plans can be developed going forward or going backward. Sometimes people can't think of what the first step is to get toward a goal. So we'll go, okay, let's say we're at the goal, and let's work backwards to where we are now. There's different ways of doing this. And then as we go through with each goal, we sort of have our action plan, and we start to execute that action plan, and then we reevaluate and readjust as we go along. So you can see this is not psychotherapy. This is a very practical and pragmatic approach to getting away from the things that pain you and getting what you want. And it works. But there isn't a lot of data to support that it works in burnout, and that's something I'd like to change. Now, what do we do when we coach? We also coach specific skills. And one of these is mindfulness. And there's been a lot of talk about mindfulness. How many of you have heard of mindfulness? Know what it is? Yeah, so, there's been a lot of talk about it. There's a gentleman that I worked with quite a number of times. I think I went to 3 of his teaching retreats. John Kabat-Zinn kind of brought the whole concept of mindfulness into modern medicine back in the 70s or 80s. He started the Center for Mindfulness in Medicine at the University of Massachusetts for patients, especially those suffering from chronic disease. And he found that they recovered better, they felt better, and so he went out and started teaching healthcare providers how to do mindfulness-based stress reduction. And I was very interested in this and went to a number of his retreats. And we'll actually do a mindfulness exercise right here. We've got plenty of time for that, so it's only taking 5 minutes. Other things I teach specifically are communication skills, the best ways and most effective ways to communicate with patients, how to communicate with your coworkers and staff, and even how to communicate with your bosses. There are sort of little mental checklists you can go through that will improve your ability to communicate, and you won't be able to sabotage yourself as much when it comes to dealing with people. Team building. This is really important for working in medical units, medical groups, medical offices. There are specific team building skills that you can use to basically empower everybody to contribute to the team. And when you have people working together, things go much better. And I don't just mean, and I used to do this, but bringing in donuts Sunday morning when you're on call at the hospital, for $5 worth of donuts, you got $2,000 worth of help. It was a good deal. But there's more to it than that. There are specific skills. And then what I call developing a stress-resistant lifestyle, which means having a way to release stress, and mindfulness is one way. It means having proper nutrition, exercise, and other habits that are ongoing that help make you more resilient and more stress-resistant. And I'm going to use this M to represent mindfulness. Mindfulness, it basically works to reduce stress both psychologically and physiologically. And that's been shown through many studies. And by doing that, it reduces the stress response, and the cycle works better, basically. And there's been quite a few studies done on mindfulness in medicine going back 30 years, and specifically in the last 5 to 10 years, on the effect of mindfulness practice on physicians, nurses, and other healthcare providers, showing that it's a very effective tool to sort of ratchet down the level of stress. So why do mindfulness? So what is the value? What would be the value to you of beginning each day with a relaxed and clear mind? Of being able to focus on your task at hand without mental distractions? Of improving your relationships at work and at home? And generally improving your level of energy and calmness during the day? Helping to separate your work life from your home life, a mindfulness practice can be great, what I would call boundary exercise, where you can set the boundary between work and home in a very clear way. Being more present for your family and friends, what's the value of that? Sleeping better, feeling better about yourself. And all this really is fairly easy to have if you develop a daily mindfulness practice. Now I will tell you that I've had a daily mindfulness practice for well over 30 years, except that I don't do it daily. This is the problem. You've got to do it daily. You know, I'm what my meditation teacher used to call a foxhole meditator, which is when the bombs are dropping and the bullets are flying, then I start meditating like crazy. It really works much better if you do it on a consistent basis, even for 10 minutes a day. And I'll show you how to do it in 5 minutes and how to do it in 30 seconds. So this is my original mindfulness teacher, other than John Kabat-Zinn, is Thich Nhat Hanh. I'm sure many of you have seen his books. He's written like many books, Zen monk and a poet. So we're going to do a little exercise I call the consciousness scan. And you know about CAT scans, you know about MRI scans. Well, this is way more powerful. This is actually a consciousness scan. And this is basically the protocol. You find a stable position with your spine straight, which means you're from your chair. Just, you sit upright like this. You can even do it lying down. You don't want to slouch, because when you're upright, it's just more dignified. It also keeps you more alert. You can do it with your eyes closed, or you can do it with your eyes, what I call defocus, which means you can look down, but not look at anything. Just try to look at your peripheral vision and not really focus on anything if you don't feel good about closing your eyes. And use your focused attention in a gentle, non-judgmental manner. Don't ask yourself, am I doing this right? The answer is yes, you are. So let's go ahead and give this a try. Just get yourself in a comfortable position with your spine straight. And you can close your eyes or just gaze downward. And especially if you've closed your eyes, just notice that when you close your eyes, you don't really do anything. What you do is you actually stop keeping them open. You just allow them to relax. And as you notice that quality of relaxation in your eyelids, just allow that quality of relaxation to be present in the muscles behind the eye, those little tiny muscles behind the eye, and the muscles in the forehead. And just unclench the jaw, let the jaw drop a little bit. You can even put the tip of your tongue up behind your front teeth, and that allows your whole mouth to relax. And allow that quality of relaxation to spread down your neck and shoulders, arms, forearms, and even the little tiny muscles in the fingers. Just allow them to relax, loose, heavy, like limp rubber bands. And allow that feeling of relaxation to extend down your back, all the way down to your lower back and your abdomen and your hips, thighs, legs, and even allow that relaxation to extend into the little tiny muscles of the feet. And just notice, how easy it is just to allow all the muscles in the body to relax and get limp and heavy and loose. And just as you've allowed your body to relax, it's also just as easy to allow your mind to relax. And so just for a moment, bring your attention to the physical sensations associated with breathing. Maybe a coolness in the nostrils, slight tingling in the back of the throat, a gentle rise and fall of the chest or abdomen. And it doesn't matter whether you take a deep breath or a shallow breath. There's really no need to control your breathing at all. All breaths are equal. no good breath or bad breath. And just notice the in-breath and the out-breath. And you may find after a few seconds, it's about all it takes, maybe 2 or 3 breaths, a thought pops up into your mind about something we're talking about or something you've got to do on the way home from work or whatever. But instead of following that thought, whenever you notice that you're thinking, you're not paying attention to your breath. So just say to yourself, thinking, and just come back to your breath. Don't chastise yourself. There's nothing wrong with thinking. Thinking happens. That's what brains do. Thought pops into your head. Just let it float away like a cloud in the sky or a balloon on the wind, and come back to that feeling of breathing. And this is easy to do. You can do it for 5 minutes, 10 minutes. You can time yourself and just do it for as long as you want to. You can even do it before you go to sleep at night. It's very relaxing. And the nice thing about mindfulness is the more you practice it, the easier it gets. It's one of those things like going to the gym. You don't just go and get into shape for the first workout. You just practice and practice. And little by little, everything gets easier. And so you'll find, you may be surprised to discover in the future, that if you do this on a regular basis, 10 minutes in the morning, 10 minutes at night, you really look forward to it. It becomes easier and more pleasant. And so with the next in-breath, just notice energy extending, the oxygen filling your lungs, coursing through the bloodstream to every cell of your body, bringing energy and awareness to every cell of the body. And again, bring your attention to wherever you are, sitting in a chair, your posture upright and dignified. And in a few moments, I'll ask you to open your eyes. And when you do so, just open your eyes slowly and gently. And just notice how you feel. And so 1, becoming more aware, more alert. 2, feeling the breath, feeling the body. And 3, gently opening the eyes. And that was like 5 minutes. You can find 5 minutes to do that a couple times a day. All you really need is a place where you won't be disturbed. Turn off your phone, turn off any sound on your computer. You can do that. So that's a technique. And if you're interested in, guided breathing meditation, I have one. You can just download an MP3 off my website. Take a card and just download it. It's free. You can find them on YouTube, although they tend to be a little more complicated. I really kept it very basic on simply breathing. Breathing meditation is probably one of the oldest forms that's ever been described. Over 3,000 years ago, and probably was done a lot before that. It just hadn't been described in a written form. So here I'm going to teach you a 30-second meditation. And this is something that's particularly useful if you have a difficult interaction at work, whether it's a phone call from an irate doctor, whether it's a patient who's difficult. If you're a primary care doctor, or if you're going to be seeing a lot of patients, I actually recommend doing it between every patient. Because what this does essentially, this is a combination of techniques, but healers that work with energy, so-called energy healers, people that have lay-on of hands, whether they're massage therapists, Reiki, various types of energy healers, have a habit of, first of all, they believe that there's actual physical exchange of energy between people when you touch. And actually, there's a lot of neurologic evidence that even if you don't touch a person having an interaction, there is an actual exchange of energy. been a lot of research, neurologic research done on mirror neurons, which show that if you observe a person acting a certain way, that the same neurons fire in your brain that are firing in their brain. That's been a physiological finding. But even if you don't, care about that stuff, you know that if you see a real difficult patient or you have a difficult interaction, you can feel bad for an hour afterwards, right? I mean, there's just a negative karma, a negative energy of some kind that follows you around and can really actually interfere with your next interaction, whether it's with a patient or a staff member. So this is just a good technique to release negative energy, to calm the mind. And one of the things that energy healers do is they put their hands in water. Well, this is perfect if you're seeing patients, right? Because every time you see a patient, you need to wash your hands, right? So you can just do it at the sink. That's what I do. Do it at the sink. You can wash your hands and take a moment. Just sort of stand there. I put my hands on the sink and just stand there. And I may or may not close my eyes. If I can close my eyes, I do. If it's going to look weird, I just sort of look down and defocus. Kind of just notice my entire environment in this moment. And say, go ahead and give this a try. Close your eyes just for a moment. And in a minute, I'm going to ask you to take a slow, gentle, deep breath into your abdomen, as if you could gather up all of the energy, all the negative energy that's come your way in the last few minutes. And then when you breathe out, just allow yourself to breathe out as if you could breathe out through the soles of your feet. So have the soles of your feet in contact with the ground, whether you're standing or sitting. And after you breathe out, at the bottom of the out-breath, just pause for 3 or 4 seconds. And when you pause, you'll notice that there's a feeling of stillness, a feeling of spaciousness. And then take a normal breath in, let it out, and open your eyes. So let's go ahead and do that now. Close your eyes. Take a slow, gentle breath into the abdomen, gathering up all the negative energies. And then allow the breath to escape as if you could breathe out through the bottom of your feet, taking all that negative energy with it into the ground. And at the bottom of the out-breath, just pause and notice the silence, stillness, and space that surrounds and interpenetrates all things. And now take in a normal breath and let it out. And that's all it really takes to really calm down in between clients after you have a difficult interaction. It's literally 30 seconds. So that's something you can practice many times a day. And that sound, that gong you heard going off not long ago, I have an app on my phone that reminds me every half hour or so. It's not exactly on the half hour, but every half hour or so, I get this bell of mindfulness, and I stop and I do this. And so I may do this 10 times during the day. And I don't know if it's true or not, but according to one of the coaches I know, he says that doing 30 seconds of meditation 10 times a day is equivalent to doing 10 minutes of meditation. So maybe it is, maybe it isn't. But if you don't have time to really set aside 10 minutes in the morning and 10 minutes at night, at least do this during the day. Try it out. All right. And as I said, this is you've got to take care of yourself, because this is the only life, the only career, the only family, maybe, that you're going to get. This is it. Just to make the most of it.